Good afternoon. My name is Dr. Ramona Coelho, and I am reading the speech by Gabrielle Peters. Good afternoon, and thank you for allowing me to speak here today. I am speaking to you from the unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. As a white disabled woman, I am cognizant that disability is a colonialist construct. Ableism is a tool of oppression, the harmful impact of which is not limited to disabled people. The mythology of an imagined white middle class abled as normal is a yardstick caked in blood. I am speaking as someone who is marginalized by poverty, excluded by ableism, and living in a province that is alienated by history and geography. A province of resource extraction and real estate speculation, get-rich-quick schemes, and libertarian pipe dreams. From a distance, John Horgan may look different from Doug Ford, but from the perspective of a disabled poor person, both men and their policies appear largely indistinguishable. BC is not better. Rejecting the science on masks, invisibilizing disabled people, refusing to disaggregate data, failing to act on ventilation, telling people to personal responsibility their way out of a pandemic, telling them to go outside and walk until they find some clean, cool air during a heat dome swirling with smoke from wildfires is not being kind, even if you say it in a modulated manner. Nearly 600 people died in 1 week last summer from heat. All any of those people needed to be alive today was an air conditioner. Sick and in need of help, they called 911. Hours passed with no one coming to save them. They died waiting. I don't like to speak about my own experiences because I know they are dismissed as anecdotal and because they fail to fully represent my knowledge on these issues. But I'm going to share some, hoping you won't see them as personal experiences, but rather as glimpses into policy in the wild. Other than to be vaccinated, I have not left my tiny unit in a social housing complex since March 2020. I have no balcony and the windows are not accessible to me. Actually accessible and actually affordable housing is a health issue. Outside feels relatively safe, but the small elevator and narrow hallways don't. I understand my neighbors can't afford masks. I have a harder time understanding the home care aides who wear them around their necks. And I have the most hard time understanding how a government can mandate masks and then not provide them to the people who need them most and whose monthly government income is often insufficient to cover food. But that's a moot point now, since the projections are still being cast aside and in-person maskless events are sanctioned in facilities that 2 years into an airborne pandemic have done nothing to improve their ventilation. I was turned away at the vaccine clinic due to my complex medical history. It was left to me to create an alternative pathway to vaccination. Here's a quick version of what followed. My primary care physician closed her chain of clinics. Specialists demanded new referrals, which I could not get. Online options had changed and required credit cards to be kept on file. Walk-in clinics no longer really exist in Vancouver, and physicians listed as taking new patients weren't. I am a non-ambulatory wheelchair user with a rare autoimmune neuromuscular degenerative disorder and multiple comorbidities living in Canada's third largest city without a doctor. On top of this, I need to counter that of a medical community that enthusiastically got behind Bill C-7 to extend state paid for and provided death to disabled people and only disabled people who are not near the end of life. They call it choice, but that implies that housing, services, supports, and income needed to live are provided, and they aren't. If a science-based doctor tells me I can't work and the government will not provide me with the means to live in the community in accordance with Article 19 of the United Nations Convention on the Rights of Persons with Disabilities, which part is it that you don't believe in? Science-based medicine or human rights? The number one thing our healthcare system needs is more money. Nothing gets better and many things get worse when a system is not funded in ways that respect the rights, needs, and health of those who is designed to serve and those who work in it. Do not go down the path of means testing for any aspect of healthcare. Universal healthcare means that it is universally covered, everything provided to everyone, regardless of income, period. Here's the second part. We need scientists focused on human rights. We need healthcare integrated into the community for the sake of community and healthcare. Fund neighborhood legal, community healthcare clinics, neighborhood centers with primary care physicians, multidisciplinary healthcare workers, social workers, paralegal, and lawyers. I want to be very clear, I do not mean urgent care centers. We need longitudinal care. The exclusive focus on acute care has almost resulted in my death on more than one occasion. The lack of longitudinal care, particularly structured to support chronic conditions, actually is an upstream feeder of acute care. Community healthcare work centers that are designed to be an ongoing part of a person's life will lead to better lives for people in the community and the development of better policy at a municipal, provincial, and federal government level, as the flow of information will be multi-directional. Fund healthcare. Fund it like our lives depend on it. No more dividing up which parts of the body will be covered. The brain is not separate from our bodies. Our teeth is not separate from our bodies. No more dividing up which kinds of science-based healthcare are universally available. What good is it to be diagnosed with a condition that requires ongoing physiotherapy if physiotherapy is not covered? At the end of the day, I am just a poor crip sitting in front of a screen, begging all of you to fight unapologetically for what is right. Stop arguing from the defensive. Demanding public funds be used to fund public services is not an immoral thing you need to apologize for. Greed is. Leaving people behind is. By the end of today, 7 more people will die of toxic drugs in my province. Fund healthcare. Provide safe supply. Thank you. Gabrielle Peters.